We're going to turn now to Clare before we get into Q&A. Clare is a pharmacist by background and the lead at Scottish Government for Near Me. It builds on an approach to video consulting that was co-designed with patients. I'm pleased to say it was supported by the Health Foundation and then through a Q Exchange Award, and it's become a source of inspiration for many across the UK and indeed internationally. Clare, please go ahead.
Thank you very much. I don't really know how I can follow that film, to be honest, but I'll give it a go. NHS Near Me enables consultations by video. Next slide, please. In really simple terms, Near Me enables patients to attend from home or from wherever they are, and we use the Attend Anywhere platform. In Scotland, the name is Near Me because that's the name that patients picked. So in the early stages of co-design, patients just told us that they didn't get on so well with the AA name and wanted a different name, so they picked co-design. They picked Near Me. Next slide, please. So we were doing some work on Near Me and had been for quite some time, and in March along with the rest of the country, everything just changed for us, and I think this quote from Trish really sums it up, that suddenly with COVID the idea of video consulting just reached a new level. Next slide, please. And so this is what happened. So prior to that point, so in February, we were providing around about 300 Near Me calls a week. And last week, it was 13,200 calls across Scotland. So across primary and secondary care in Scotland. So a real rapid increase in just a 10-week process. And I'll come back to how some of that's been achieved. Next slide, please. Just to give you a bit of a kind of a taste of the different specialties that are using Near Me. It's really broad. I think just about every specialty is covered in some way or another. Next slide, please. And at the end of every consultation, we do ask patients for feedback on whether they're happy to use Near Me again, and this is the response. So a really positive response in terms of people being happy to use it again. And on the next slide is just a few of the comments that have come back from the patient feedback. Next slide, please. I'm going to go right back to the very beginning and talk about how the service was developed just in the really early days, and draw on just two kind of key elements. One's co-design and one's systems thinking. So next slide, please. So this was back in NHS Highland when I started working on Near Me, which actually came just after the first bit, which was around Pharmacy Anywhere, which was the Health Foundation funded project. And then we moved into outpatients as a whole. And when we did that, we very deliberately took a decision to spend 6 months co-designing Near Me with patients, with clinicians, and with all the staff that are involved in outpatient appointments in any way. And I want to just mention the two kind of elements of co-design. So the first phase we had before the service started, so that was looking at the initial design of how the service would work, and we had a whole number of kind of focus groups and public meetings and meetings with individual patient groups and talking to clinicians about how the service was going to work. But we didn't stop there, and I think this is the important bit in terms of why the co-design worked for us, was we then went into a period of continual testing and changing. So after every single clinic, we asked the clinician, we asked the patients for feedback, we talked to everybody else who was involved in getting those clinics up and running, and we made over 100 changes to the service during that time. Once that part was done, and it was done in quite a safe environment, so we had one remote clinic working with all of the main hospital services. We then moved into a second phase when we wanted to enable Near Me at home. So this is with patients to attend from anywhere from home, and that was the project that was funded through the Q Exchange. And again, a whole lot of co-design with some fantastic patients who did the same sort of approach. We had a focus group, we sort of had some discussion, and then we went into the testing phase as well. So next slide, please. The other part that I think was really essential to that early process was around systems thinking. So this is actually the fishbone from January 2018, where we tried to identify all the different things that you needed to think about in order to embed a change of video consulting into a different way of working. So main areas, thinking about the people involved, the systems that are involved, the different processes around appointment booking and room booking and clinician setup, the resources that we required, both financial and kind of things like strategic support and so on, the equipment and the environment. So all of that had to be thought about and then combined with the co-design. Next slide, please. And I'm not going to go through all of these, but just to draw out that there were so many changes were made because of this approach. So things like patients said, well, we actually find this really difficult. We lack confidence in going into this new way of consulting. So patients came up with the idea of, well, why don't you have a try it out session? So we did. We just launched it on a Friday afternoon. Any patient could come along and test it out and see how they got on with it. And that's the sort of thing that helped to build confidence in using the system. And I think in terms of the kind of the appointment booking side, spending quite a lot of time in embedding Near Me into that existing booking systems helped with the scale up that then followed. Next slide, please. And so if we now move on to what's happened since, so when faced with the how do we rapidly expand in response to COVID, we had a very clear 3-step process, and that's these 3 steps. So the first one is the technical setup. So technically, what do people need to be able to use Near Me? They need an internet connection, they need a device, and they need the actual waiting room set up. The second area is the service processes. So that's that detail around how it's going to be embedded into the normal working of the service, whether that's outpatients or a GP practice. And then thirdly, the individual training that's needed for clinicians using it. Next slide, please. We've been hugely lucky in the support that we've been provided with by so many different people and organisations within Scotland. So this is a list, and actually there are many more, but we could not have done what's happened without all of these key people who've been involved in different ways. Next slide, please. So a couple of kind of things that we've provided in terms of national support. One is implementation guides. So to help people through that service process and stepping in, we've got lots of guidance which is available at tech.scot. Next slide, please. And we've also put a patient information website together nationally. And going right back to that patient who told us that we really needed to make it easy to test out before they had their first Near Me appointment, this has got a make a test call function in it. So anyone can just go in and try it out. So we've tried to carry some of those themes of co-design right through. Next slide, please. And in terms of the training, we've been working with NHS Education for Scotland, and they have put together the this page that contains the kind of the key elements of training. I really like the video consulting skills, because recognising that actually consulting by video is quite different to consulting face to face. Next slide, please. And finally, I think something that's been really important is around shared learning. So both with NHS Education for Scotland and with Healthcare Improvement Scotland, some fantastic webinars and WebExes to share the different clinicians' stories of how they're using Near Me, and that then helps other people to join in. Next slide, please. So finally, I just want to kind of finish off with kind of Near Me in the new norm and where we see things going next. Oh gosh, I've just lost the meeting for a minute. There we are. So Near Me going forward, we think that that video consulting will become part of how all health and care consultations may be provided in future, whenever it's clinically appropriate, and being really clear that it is going to be about clinicians deciding, is it clinically appropriate for this situation, for this appointment, and also is that acceptable for a patient. Next slide, please. And the 3 key reasons for looking at this is firstly to enable continued physical distancing. It's going to be around for some time to come, so recognising that both for patients and clinicians to be able to be remote. Next slide, please. But secondly, going back to why we started Near Me in the first place, around person-centred care. So there are so many reasons why people find it difficult to attend appointments, whether that's because they live in a remote location, whether they've got transport difficulties, mobility issues, whether they're caring for people at home, and really importantly, work is a barrier for so many people, and particularly people on low incomes, where their employers do not let them have time off to attend appointments. So enabling people to attend in the most convenient way for them is an important part of video consulting. Next slide, please. And finally, I can't talk about Near Me without talking about the environmental impact. And actually, this is really important. We have to find better ways to deliver NHS services that doesn't involve either patients or clinicians getting in cars or getting in transport all the time. Next slide, please. So our next steps are to develop our vision for what Near Me is and how it's developed over the past 10 weeks into an actual delivery plan for the rest, for what's coming up. I'm very keen to set up a Near Me Improvement Collaborative to continue to share the learning and support people going forward to take up video consulting. And finally, we need to improve our data systems so that we've got more visible data for individual clinicians to understand. Thank you very much.